We think of statins as working in many different ways. Statins as a class are so beneficial for lowering cardiovascular risk. There is very clearly a role for using statins both in the realm of primary prevention as well as in the realm of secondary prevention. Primary prevention means preventing something from occurring for the first time. For example, preventing a person from developing heart failure, preventing a person from developing coronary artery disease. We know that there is a very clear role for using statins in a primary prevention setting in patients that have a high risk of developing a problem with the heart, such as a heart attack, such as a stroke. Statins decrease an individual patient's risk by lowering inflammation and by lowering cholesterol levels. Patients that are at higher risk that would benefit from a primary prevention approach are patients who are smokers, older aged patients, patients with diabetes, patients that have high blood pressure, things that increase your cardiovascular risk. Secondary prevention is the prevention that we use for a second or a third or a subsequent event. We know that there is a very clear role in using statins for patients who have already had a heart attack, already had a stroke, already developed heart failure from blockages in the arteries and a weakening of the heart. Those are patients that very clearly benefit from high-dose statins because we can decrease the risk of that patient developing another problem with the heart. I cannot say enough times to patients how critically important it is to maintain an ideal body weight, and if you're overweight, to lose weight, to exercise at least a little bit every day, get the juices flowing, go outside, take a 20-minute walk, don't eat things that are high in sugar or high in fat. We can give a patient any medication in the world, but if a person isn't empowered to change their lifestyle, then we're not doing the best we can for that individual patient to decrease the risk of a cardiovascular event.